So what's the recovery like? What can they expect on that first night after this Dupuytren's procedure?
Right. For the minimally invasive needle aponeurotomy, it's literally a no incision technique. We use hypodermic needles and make punctures. Sometimes those punctures can tear, the skin will open slightly, so you do have to treat it like a surgical wound, but we put a bandage on. I usually will tell patients to leave the bandage on for a day or two. They can wash it and start moving their hand immediately. I caution patients, because they do so well, to be careful. You don't want someone who feels great to then stick their hand in the dirt and get the infected tiny wound. But other than that, it's remarkably minimally sore.
Do you give them pain medications? What are they taking
I
usually?
do, but the majority don't need anything more than Tylenol or over-the-counter anti-inflammatory.
That's good.
And they're back in action for golf. Maybe not full rounds, but maybe some par 3 chipping and putting in a week, and whatever your hand is up to, right? And there's very little therapy involved. Usually your fingers are feeling stretched because they haven't extended maybe for years, but you can increase your activities gradually, and there's very little need for any kind of therapy.
When do they come back for a follow-up after the surgery?
I see them in a week. Even though there's nothing to do, you still want to talk to them. You want to see how they're doing. You want to make sure there's been no
Do some
interesting
people ever
outcomes.
exaggerate, like you said? They say, "Doc, didn't hurt at all. I feel 100% better."
Absolutely. Well, the thing is, the guy who's had a bent finger for 10 years and has a straight finger is so excited.
Okay, good.
And it really, they're like, if I knew it was that easy, gosh, I should have gotten this done earlier. And it's true, especially now that we have these minimally invasive techniques for Dupuytren's contracture. This giant surgical encounter with the expense and the recovery and the prolonged therapy is now downsized.